Hello, I'm David Zakim. I'm a professor of medicine and I'm a specialist in internal medicine. I want to take a few moments of your time today to discuss how physicians collect the information we need to make good diagnostic and treatment decisions. And I also want to ask for your participation in a clinical research program to help us get this information. Lots of non-physicians believe we rely primarily on laboratory testing to make good diagnoses and to make good treatment decisions. This is only partly true because laboratory testing cannot give us the information we need to have, especially to make good decisions about diagnosis and treatment in patients like you who are coming to an emergency department with chest pain. For example, there's no laboratory test that can tell us where in the chest you experience the pain, the setting in which the pain begins, how you might relieve the pain, the severity of the pain, and several other characteristics of the pain which are clues to its cause. In addition, we need to know about your risks for heart disease. Laboratory tests cannot provide us enough information about your risks. We also need to know the function of all your vital organs because none of the organs function independently of the others, and the health of the heart depends on the health of all your other organs as well. We need to know about past medical illnesses. We need to know some things about your lifestyle. We need to know what medicines you might take, and we need to know something about family members who might have had heart disease, which would indicate a higher or lower risk for certain forms of heart disease in patients like you with chest pain. Also, almost every patient with chest pain will have an electrocardiogram and certain blood tests done. But in many patients with chest pain who are suffering a heart attack, the electrocardiogram can be normal and even the blood tests can be normal. So we rely heavily on information we get by interviewing you in a process we refer to as history taking. Now, the other thing I need to talk to you about is I want to ask that you participate in a research program in which we're testing innovative ways to collect the history data or information we need about you. We need to ask for your help in this regard because we no longer have the time that's required to interview each patient, especially in the hectic environment in an emergency department, to get all the information we need to make the best decisions about diagnosis and treatment. So we're testing a computerized program which interacts directly with people like you, patients, to collect their history without our input. This makes better use of our time in the emergency department, and it makes better use of your time and would provide us with all the information we need at the time we would come to examine you. Now, if you agree to participate in this clinical research program, you'll use an iPad which will present questions in the form of text and some questions in the form of images, and you will tap on certain on answers on the iPad that are appropriate for you. So the use of the program is easy. The program emulates the clinical thinking of a panel of expert physicians, including cardiologists. So the program asks only questions that are relevant to your medical needs and that are relevant to the personalized needs, which will be revealed by your answers to questions as the interview proceeds. Because it's personalized and is not simply a questionnaire, the duration of your interview depends on your past medical history and the nature of the chest pain that you're experiencing now. If you agree to participate, your participation will not interfere with your care, it will not affect your care, it will not prolong your stay in the emergency department. The interview will be interrupted for all routine care at the discretion of the nursing and medical staff here in the emergency department. If the staff decide that it's safe to send you home or you need to be admitted to the hospital, the interview will also be stopped. and you are free to stop the interview at your choice if you feel you need to ask for medical care. You should also know that your care will not be affected if you decline to participate. Now, since this is a research program, we will not use the information collected by the computer to make any treatment decisions or diagnostic decisions. What we'll do with this information is compare it with the information in your official record, which is generated by the medical staff in the emergency department, to determine whether the computerized record could have improved the treatment and diagnostic decisions made by the medical staff today. And we'll also look at the possibility that the computerized history data could have avoided the time-consuming and expense of certain laboratory tests which might or might not be done in your instance, from which you would receive no benefit. Now, since some of these tests can have side effects, some patients will be spared side effects. Another important aspect of the computerized history we're looking at is the possibility that patients like you who have chest pain could interact from home with this program to determine before you leave for the emergency department whether in fact you need to come because you're unlikely or highly unlikely to suffer from a serious illness, and you'll receive no benefit from coming or from the care you would get in the emergency department. One final point I want to make is we are not testing a commercial program. The technology and its medical knowledge is owned by Karolinska Institute, and the medical knowledge is developed by the faculty of Karolinska Institute. Let me thank you for your time, and I want to thank you in advance for your participation in what we believe is an important clinical research program.